Welcome back to the Med Gym. This is David Drinks with another Technique Tuesday for you. And in this week, we're going to talk about one big technique flaw that I tend to see when people do planking exercises, which also translates into a lot of other functional movements. What you doing there, Rose? Nice setup you got.
Can you not take a picture of me?
The human body, especially as it relates to training and exercise, is that it's a tremendous compensator. In other words, it's going to get from point A to point B in the most efficient manner possible, and it's going to tend to use the muscles that it's used to using that are overactive or that are stronger, and not use the muscles that are inhibited or weaker. And when we set up in a plank exercise, that tends to look like this. I'm going to set up down here, and I'm going to drop into, instead of a good flat plank position, we tend to see a lot of hips rising up, people rolling the pelvis forward into an anterior pelvic tilt. To give you an idea of what anterior pelvic tilt looks like on the feet, we typically see people who stand in more of an arch back position. They have the hips that are rolled forward versus being in a posterior pelvic tilt. So if I'm doing that plank in this position versus in this posterior pelvic tilt position where I'm engaging the core muscles, that's going to change the muscles that I'm using during the exercise. So as we set up for a plank, we want to make sure that people aren't in this arched up position, hips rising, because what that's effectively doing is taking out the abdominal muscles and just allowing them to overuse the hip flexors to do that plank stability exercise. And that's an important concept because it not only relates to planks. If you do a plank this way all the time, or your hips are too high, you're not in this brace position squeezing the glute muscles to get the pelvic tilt back, you're going to end up not training the abdominals and you're going to use the wrong muscles for stability. So one of the reasons it's so important to build proper pelvic positioning into the plank exercise is not only because that's going to make that exercise more effective and make sure that you're using the ab muscles and not overusing the hip flexors when you're planking, but it's also a good way to build from the ground up a awareness of pelvic position and using the proper muscles when you're doing any kind of functional exercise. And one way that translates up to a functional exercise is one that we like to use a lot here at the Med Gym, a hip hinge exercise or a deadlift exercise. A deadlifting exercise is a really good way to train the back of the body, the posterior chain, meaning the hamstrings, the glute muscles, the low back, the upper back, and training good lifting technique off of the ground without injuring the spine. And one of the biggest problems we see with that comes back to the pelvic positioning when you go through a deadlift. So one of the ways we like to make people aware of this is using a dowel rod on the back. And in this case, when we go through a hip hinge, we're bending over to pick something up off the ground. The dowel rod gives me some feedback that I'm maintaining a flat spine. So in this case, we want to have a little more of an anterior tilt at the pelvis. So the back is in a good flat position here. If I go too posterior tilted, I'm rounding the hips underneath me. I'm actually going to roll through the back as I go through it. So the difference between feeling it in the hamstrings and using those muscles properly during a hip hinge or a deadlift exercise versus feeling it all in the low back and using the low back muscles improperly during a deadlift is really just more of the pelvic position. Is it anterior tilted or more posterior tilted? So you can use a dowel rod on the back. Make sure you keep it tight to your tailbone, to your upper back, and to your head the whole time as you bend at the waist. And that'll give you some feedback that you're maintaining a proper pelvic position. Thanks, Rosie. That way when we move into any kind of lifting with some resistance, now we're going to feel it in the right areas. So we're going to go through a Romanian deadlift, in this case with a barbell. We back it out, and I'm maintaining that shoulder back position, anterior pelvic tilt, not getting into a rolled back position, and I'm going to go down the legs and pull back up. So as I maintain that pelvic position, I feel the hamstrings pulling, I'm using the proper muscles, I'm protecting the back, versus if I posterior tilt and roll forward, now I'm stretching only the back muscles, and I'm only going to use those to pull back out of that exercise. So being aware of the pelvic position in any exercise, whether that's a plank on the ground, which is a great way to build that awareness of pelvic position, or even any functional movement up on the feet like a deadlift or a hip hinge exercise, being aware of that pelvic position is going to not only make the exercise more effective. In the case of the plank, you're going to use the correct muscles. You're actually going to use the abdomen instead of shying away from that and overusing the hip flexors. And on the feet, in the hip hinge or deadlift, being in the proper, in this case, anterior pelvic tilt position, you're going to engage the hamstrings properly instead of overusing the low back muscles. And the other scenario, if you posterior tilt too much and you roll through the back to get down to that picking the weight up off the ground or hip hinging, you're going to overuse the back muscles, stress the low back, and not train the hamstrings and the glutes that you're trying to train with that exercise. So there you have it, another Technique Tuesday video looking at posterior versus anterior pelvic tilt and how that relates to a plank and a hip hinge or a deadlift exercise. Very important to be aware of those two scenarios and how you're setting up for the exercise and what muscles you're engaging to do the exercise properly. So you're not overusing the wrong muscles, you're not putting the low back at risk, you're training in the case of the plank, the abs properly. In the case of the deadlift, you're training the hamstrings and the glute muscles and not the low back.